balance also. So as a post delivery time, we should not focus on too much of exercises or anything, because it might affect the like baby, like breastfeeding also. So what you can do in this sense, if at all you really want a proper guideline, you can connect with us. We will guide you on that, because every details also we need to be checked during the delivery time and pre-pregnancy time. So if we are able to collect all the information from you, then it will be like grateful then. Which food is beneficial for hypothyroidism and PCOS for 15 years teenagers? So there is no any one particular food or drink or anything for resolve of this hypothyroidism or PCOD. Rather than concentrating on one just food, you need to concentrate on balanced nutrition, include of fiber, vitamins, minerals, enough amount of protein, and even carbohydrate also. So just with one food, no, we will not be able to complete resolve this. You need to be work on entire thing, not only diet. You need to be concentrate on physical activity, and if you are like sleep, it is not in the correct form or anything, you need to be work on that as well. And if you are a very high stress person, you need to be work on that as well. So completing all these lifestyle factors, if you are able to take care, then you will be able to see a changes. So Prashu have been asked this question. If you really want a proper guideline, you can DM us. So we'll get back to you, dear.
I am facing a hair fall due to PCOS. Please explain how cure this hair fall. Hair fall is the main symptom in PCOS. PCOS, as you know, PCOS is the hormonal imbalance. The root cause is hormonal imbalance. First, we have to treat the root cause, that is hormonal imbalance. Then only your symptoms like hair fall, acne, that will be automatically cured.
Yes. Where which have been taken? This only, no? Is it possible to get pregnant
with the
fatty liver issues? Definitely you can.
But it is challenging, but
you need to be work on your lifestyle factors. See, fatty liver will not be causing any like any dangerous points for conceiving or anything, if you are managing well with a proper balanced nutrition and physical activity. What all the like main hormonal imbalance or anything, if you are taking care on that part, then definitely it is possible here. Don't want to get worried about that. My AMH is 2.87 but not getting conceived for 2 years. So Ashna have been asked this question. See, just with one word we will not be able to tell you regarding what will be the main cause of this not conceiving. So it might be whatever the egg quality, because AMH will not determine the quality of egg, right? So might be the quality of egg have been produced, or else your hormonal imbalance, anything. So these all things we wanted to know a detail about your history, Ashna. So if at all you really wanted a proper guideline, you can DM us. Definitely we'll review all your case details and everything in detail, and then we'll give a proper solution for that. How to reduce 115 level prolactin level naturally? Yes, so concentrating on hormonal balance consists of good food changes, because there is no any one such particular food to reduce the prolactin level, you need to cut down your like fat in the form of trans fat and highly processed food and everything. You need to be completely avoid, since it will give you inflammation. So even inflammation also one of the reason why this prolactin level is going high. So you need to be work on that. Try to consume good amount of fiber rich food, anti-inflammatory food, and be active on daily basis, and go through a stress management practices, practice pranayama. So if you are focusing on all these, then you will be able to see the changes. In period time, can we do yoga? So try not to do heavy type of exercises during like overflow days. You can practice it if you are comfortable with whatever the situation, like bleeding days or anything. You can practice. There is no any adverse effect if you are practicing yoga on your period date. Something like dangerous point will happen. Nothing like that. If you, it's up to you actually. If you are comfortable with whatever the bleeding days or anything, you can practice even yoga. But even severe bleeding for more than 7 to 8 days and it is not going to be stopped. If you have a history of severe menstrual bleeding for more than 10-15 days, those situations try to avoid. Take rest for first 2 to 3 days and then you can start practice yoga or exercises. Kannada language PCOD.
For dark circles, a proper sleep should be there. So if you are not getting a proper sleep and all, automatically you will get a dark circle. So
you need to be work on your life, like you need to be work on your hormonal balance also, because hormonal imbalance also one of the root cause of dark pigmentation. So we need to be work on that. If you really want a proper solution, because just with the one point will not be able to take care, so you can reach out here actually. Can hypoplastic uterus and ovaries can be cured with the time? No, because since it is a structural abnormality, no, will not be able to correct through a only with lifestyle factors. You need to be consult with the allopathy doctor itself for that. Period high flow for 15 days. So 15 days of bleeding, obviously it is not normal. So severe bleeding might be due to hormonal imbalance, and even endometrium thickness is too much thick. So there is a chance of severe bleeding. So inflammation also one of the reason, needs to be work on that. First of all, whenever you are bleeding for more than 15 days or 16 days, try to avoid all excess type of physical activity and all these food which is highly processed and trans fat on those things, because it might increase the heat in the body and it might increase the bleeding. So focus on that. But if it is prolonged for more than 20-25 days, you might go for some iron deficiency. So consult a doctor if at all prolonging for more than 20-25 days. Period is regular but too light bleeding. Okay, short duration of bleeding in that, last for 2 days only. So hormonal fluctuation, hormonal imbalance, again here one of the root cause. See, it is depend upon the endometrium lining health also. So if it is very light form also, it might cause this low flow. So concentrate on pelvic strengthening yogasana. If you are experiencing the bleeding just for 1.5 day to 2 day, concentrate on pelvic strengthening yoga asana, which will helps to improve the blood circulation towards ovaries and uterus. Not only that, consume good amount of iron rich food during your premenstrual time, like or post ovulation time. So concentrate on iron rich food as well. Try to consume good amount of green leafy veggies which is rich in iron. Yes.
Suggest diet for fatty liver and PCOS. For PCOS and fatty liver, first you have to reduce your weight and fat percentage also. So a balanced diet, then a proper physical activity, and staying active in a day, it should be there. So you can manage your fatty liver and PCOS.
Yes. And want to blocked and ectopic pregnancy and possible to get pregnant naturally. So AMH is 0.3 and one tube blocked and one tube and ovary removed due to ectopic pregnancy. Possible to get pregnancy. So even age also is really matters here. If you're crossed 30 32, that is like it is risk in like factor actually, but what you can do in the sense, see, if you really want a proper solution, because we wanted to know detail about you, what was your past histories and how long, what all the medications and everything. But since it is like tubal blockage or anything, definitely will not be able to take care through just with the medication. You need to be work on that, like whatever the surgical management with allopathy doctor suggested. Even after that, you can come here for improving the egg quality and to work on our hormonal balance, especially these AMH and prolactin, those things. You can reach out here. How to prepare ourselves for normal delivery. So first of all, we will not be able to predict it, like whether it will be normal or like C-section. Only one thing what we can do from ourselves in the sense, on each trimester of pregnancy, always concentrate on like nutrition, because in each trimester wise our nutrients is demanding, like even iron, folic acid, like all these nutrients are demanding, even calorie based also. Concentrate on nutrition basis. If you like going through a like whatever the expert guideline, you will get to know what exactly you need to be taken in the form of food wise, and even physical activity also, trimester wise yoga. So here we have even pregnancy journey also. So if you really wanted to observe, like if you really wanted to join, you can, because here we will be guiding you on trimester basis of nutrition and trimester basis of yoga as well. Help me for PCOD. So we have been explained what all things needs to be taken care for the PCOD issue. It's because first of all, hormonal imbalance and insulin resistance and lifestyle factors is the main root cause. So if you really want a proper guideline, who's that? Calm breath. You can DM your number here, so my team will connect with you. They will be explain you in detail about that, because just with one single word, PCOD cannot be reversed here. My HbA level is 13, but ferritin is lower than normal. What could be the reason? How to correct this? So iron saturation, like iron absorption also might be the reason for why ferritin is going low. see, for like always we will be concentrating on iron rich food, but nobody is taking care of how this iron absorption is going to be happen. So low absorption of iron will be leading to this. Always whenever you are taking the iron rich food, make sure that vitamin C also will be taking along with that in order to increase the iron absorption. Try with this point and see. How to take appointment? Mansi, you can DM your number and my team will get back to you for the appointment. They will, like, here you will be getting a one-on-one consultation with our expert. So if you have any scan report or any blood work, even you can submit that also, so that we'll be able to review your case in a detailed form. So you can DM your number and name here.
Facial hair. Facial hair is mainly because of your androgen levels. Androgen means your male hormone. In your body, male hormones will be more, then you will get facial hair. For that, you have to work on your lifestyle. Lifestyle means hormonal balance. You have to maintain your hormones. So you have to work on it.
Yes, uterus strengthening exercises and yoga, ma'am, and how to protect our uterus from infections. What type of infection you mean, dear? Shobha, can you please repeat your question? Severe hair loss, how to stop? So find out the cause for hair loss, dear. It might be due to iron deficiency, or it might be due to hormonal fluctuation. So needs to be work on that. If it is a hormonal imbalance, first of all you need to be work on like to reduce the inflammation from the body, and try to concentrate on balanced nutrition, and try to include more of iron rich food. Like if at all you have any reports or anything, you can reach out here. We will explain you regarding that. Then diet for autoimmune disease like lupus erythema, is it reversible? It will not be like with the diet. No, it is not reversible. We can improve the quality of life by including lifestyle factors. Will be able to, because autoimmune condition, it's a genetic and will not be able to reverse it just with the diet. You need to be work on like the medicines also. HB is 6, iron rich diet. So HB, since it is 6, it is very low. You need to be start with the supplement also, and moreover you can include a good amount of lentils. All type of lentils are rich in iron and even protein also, and a good amount of green leafy veggies, and all these non-veg sources and veg sources also there. So non-veg sources, even all chicken, organ meat and those things. But only one thing, keep this point in mind. If at all you are taking iron rich food in the form of supplements also, or food form also, make sure that vitamin C for a better absorption you will be taking along with that. Can we recover from low thyroid during pregnancy? How does it impact pregnancy journey and delivery? So as we all know, like thyroid health is very very important to maintain a healthy pregnancy. So if you have been diagnosed for thyroid with pregnancy, then take a better take a guideline from the expert itself, because whatever we are getting from online platform, it will be a general thing. So you can take a expert guideline, because needs to be work on that. There are some food substances needs to be restrict also, and needs to be include also, but just with one word I will not be able to explain, because pregnancy, it is trimester wise also, so better take a appointment here. Hello mom.